Welcome to Ostomy 101 segment on Stoma Basics. My name is Dawnette and I have an ostomy. We're going to be talking about Stoma Basics back and forth today with Star Harrison. She is a CWOCN, a wound, ostomy, and continence nurse. And we're going to be doing a little bit of back and forth today. She's going to be talking about Stoma Basics from a clinical perspective, and I will be talking about it more from a personal perspective. Can you tell us what is a stoma?
A stoma is a surgical opening created through abdomen to allow stool or urine output, depending on what type of stoma you have.
Or can you tell us what is a stoma made from?
So a stoma is made from an intestine. It could either be a small or large intestine.
I have noticed that with my own stoma that it's kind of red or pink and it's moist all the time and a little squishy. Why is that?
It's because it's made of mucosal tissue, which is similar to the tissue inside your mouth. It's smooth, it's very vascular, and it's very delicate.
Okay, so what I'm seeing in my stoma then is the mucosal lining of my intestines.
Yes.
And it has a similar property as the inside of my mouth, that
Correct.
It's always moist and a little bit pink. Is that right?
Correct.
I have also noticed that with my own stoma that it moves a little bit. What is that about?
It's because of the feature of the peristaltic motility of an intestine. It has that movements and it creates noise, and that's what that is.
Yes, I've noticed noise too. I've noticed that I don't pass gas the traditional way anymore, that gas actually passes through my stoma. So that's just part of the natural peristalsis of my intestines. Is that right?
Correct.
Star, you mentioned that stomas are vascular. What does that mean?
It means that it has a lot of blood vessels and it can easily bleed, and so it's very delicate and sensitive.
So that means that sometimes I've noticed with my own stoma, when I'm changing my pouch or when I'm just wiping with toilet paper, it bleeds a little bit. Is that normal?
Yes.
But I need to be gentle.
Be very gentle.
Be
with
very
your stoma.
gentle. Star, I've also noticed with my own stoma that when I touch it, I can't really feel it.
And that's because your stoma does not have nerve ending, so there's no sensation. And there's also no sphincter. So the stool or the urine will just come out.
So there's no sphincter.
Yeah.
It's just in the open position.
Yes, it will always be in an open position.
Okay, so that's why we wear a pouch, right?
Yes, it contains the output.
Right after my surgery, my stoma was really swollen.
And that is because your stoma is very inflamed right after surgery. And that is why it's so important that you measure your stoma size so that you can cut your wafer based on the size of your stoma. And it will decrease from 6 to 8 weeks. So it's so important to measure it once a week.
Once a week. So what you're saying is that my stoma is going to shrink over time, and that's why it's important to use the measuring guide to measure my stoma and cut the wafer to the right size to prevent leaks, right?
Yes, correct.
I've heard the term peristomal skin. What is that?
That means the skin around your stoma.
So what should the skin around my stoma look like?
It should look like just the rest of your abdomen or the skin in your body.
Star, can you tell us when should we call or make an appointment with a WOCN?
As soon as you notice any type of skin irritation, recurrent leakage, bulge in the skin around your stoma, excessive bleeding, persistent diarrhea, abdominal pain, and vomiting with diarrhea.
We're going to break this down a little bit. Star, can you tell us what do you mean by skin irritation?
It means when there's an itch, rash, burn, and weep and moist.
And you're talking about the skin around your stoma, if it's itching, burning, weeping, those
Correct.
kind of things, right?
Yes.
Well, I have noticed from time to time that underneath my wafer, every once in a while, I just get a little bit of itching and burning. Is that kind of the beginning?
Yes, and that's the time when you're going to call your WOCN.
And I've heard you say before that it's much easier to get on top of if we come at the beginning of some of those skin issues rather than at the end.
Correct, because it's easier to treat.
Another reason that you listed for calling your WOCN was leakage. Can you tell us why that's important?
because when it leaks, it will irritate your skin around your stoma.
So it can start to cause sores or irritation, right?
Yes.
Now, how do I know I'm having a leak? I mean, there's the obvious, right? You can see it, but sometimes there are minor leaks, right? That we can't always see.
So I really want my patient to look and assess the leakage right on the base or the center of a wafer. When you see any kind of discoloration or any type of lifting of that wafer, there's already a sign of moisture underneath that, and not to wait until the leakage is on the edge of the wafer or the skin plate.
All right, so sometimes there's a leakage that we can't see. And I feel with my own experience sometimes that I can't see a leak, but sometimes I feel a little itching or burning in a particular place. Is that kind of the beginning of a leak?
Yes, that's
Or
a
it can
very
be.
early stage of it.
Another reason you listed calling your WOCN was bulging around the skin of your stoma. So you're talking about the skin around your stoma, just a little bulge, right?
Yes, because that's an early stage of herniation.
And then bleeding. We talked a little bit about that your stoma is vascular and a little bit of blood is not cause for alarm. So Star, can you explain when we should call the WOCN?
When you notice that there's more than 2 tablespoons of bleeding in a 24-hour setting. I know.
All right, so 24 hours, 2 tablespoons in our pouch, right?
Yes.
Another reason you listed for calling your WOCN and making an appointment was excessive diarrhea. Now you're talking about excessive diarrhea without flu-like symptoms, right?
Yes. And that's when you're practically squirting out fluid with no stool, abdominal pain, and nausea and vomiting.
And no fever, right?
No fever.
No fever. WOCNs like Star are a great resource for ostomates like me because they can help us troubleshoot some of the questions or the issues that we might be having. But Star has a great idea.
It's a good practice that when you make those appointments with your surgeon right after surgery, that you also make an appointment with your WOCN right after surgery.
So that post-op appointment with our surgeon, that's a great time to have an appointment around the same time with your WOCN, right?
Correct.
But if your WOCN at the facility where you had your surgery is not accessible, there is another option. There is a telemedicine company that has wound, ostomy, and continence nurses that are certified that are available to you through your computer or your smart device. And you can find that information on our app. So be sure and download the app.